Okay, and the last video for this unit is on rehabilitation and restorative care. So check out your textbook, chapter 25, for more information in this area. Rehabilitation, the purpose is to restore a person to their highest level of function possible. And this can be after an illness or an injury or something along that line. Rehabilitation treats the whole person. It uses holistic care, and that means you're looking at all parts of the person, not just their physical, but their spiritual, their mental well-being, and then also their body. There are several factors that affect the progress of rehabilitation and how well a person does, and that can include how soon rehab has started after the injury or the illness, any pre-existing diseases or injuries. So we talked last unit about breathing problems, right? COPD, emphysema. If a person is trying to do physical therapy every day and they struggle to breathe just to walk across the room, you can see how that pre-existing disease could make their recovery much harder. Overall motivation. Those that are lacking motivation will not do as well as those that are highly motivated. So attitude, a positive attitude, a lot of family support, a lot of motivation really will improve the outcome. The type of facility they're in. There are a lot of places that say they do rehab, but there are certain ones that are much better quality. They look at physical therapy, occupational therapy, speech therapy. They incorporate it all throughout the day. The nurses are all on board. It's very much a team effort, and that's the kind of facility you want to be in. This staff, family, and friends all have to be upbeat, positive attitude, cheerleading throughout the whole thing. Attitude of the rehab team. They should be focusing on what that person can do, not what they can't do. So if they're focusing on what they can do and they're being positive rather than negative, that really helps with that recovery process. And then the consistency in the care plan, and this is about your role. If they are to get up out of bed and walk to the bathroom and you are putting them on a bedpan or on the bedside commode, you're not being consistent in the care plan, and you may be stalling their efforts in their rehabilitation process, which may make it longer before they're able to go home. So make sure you know what your care plan says when you're working in the rehabilitation setting. So the rehab team involves everybody, but always remember that the resident is the most important member of the rehabilitation team. Restorative care, this is about restoring and maintaining that resident's function. You want to, restorative care comes in after they have gotten to the highest level possible through rehabilitation, and then it's trying to keep them at that level so they don't go backward. So when you see physical therapy over on the 100 hall in clinical and they are taking somebody for a walk, that's not rehabilitation, that's restorative care. So that person maybe has lived here for a year, they're not in active rehab, but they don't want them to decline and become dependent on the wheelchair. So they are coming in and they're still working with those people. So that keeps them at a higher level of functioning as long as possible. Loss of function can cause a person to become dependent on others for their activities of daily living, and this definitely affects their self-esteem. The more a person can do for themselves, the better off they are. So we want to really encourage that. Yes, we want to check off on our skills, but if they can do it themselves, let them do it. If they can brush their own teeth, if they can brush their hair, if they can wash areas of their body, we want them to do that. If they can push their wheelchair, that's therapy right there. You know, they're working their arms, they're pedaling their feet, they're working their legs. It's all very, very important. Remember, we're always encouraging independence because that promotes a positive self-image. So let's talk about when a person is immobile and some of the complications that come as a result of that. You can check out page 446 in your textbook for more information on this. So first of all, one of the complications of immobility would be a decubitus, and that is also known as a bed sore, breakdown in the skin, something along that line. Blood clots, we've talked about that. Thrombus is a stationary blood clot, and when that stationary blood clot breaks loose and starts floating through the body, it becomes an embolus. These can be very deadly. It's really important that we keep them moving so that they don't have these blood clots form. Muscle atrophy. Atrophy is a word you're going to want to know for your quiz and for the final. That is when the muscle wastes away. And then contractures. Contractures are permanent shortening of a muscle. So if they don't use it, they lose it, and it permanently shortens, and then they've lost the ability of that arm or that leg or the hand to be able to function. So let's look at some pictures. This is an example of atrophy of the muscle, and you can see the legs have lost a lot of muscle mass. They're kind of wasting away. Think about like if you played sports in high school and you were always working out and whatnot. Then you got out of high school and you stopped playing that sport. You lost a lot of muscle because of the lack of use of that. Well, that's the same situation as somebody who maybe is very active, walks all the time, and then they go to a nursing home facility and then they stop walking or they stop standing as much as they used to. Their muscles will start to waste away. This is a picture of a contracture. It's that permanent stiffening of the joint, or it can be very painful. You can see her hands are stuck in that position, and she won't be able to straighten that out again. And so there's some different orthotic devices that we can use to try to prevent those things. When we talk about orthotic devices, we're talking about devices that are applied externally to the limbs, and they help to provide support and protection, improve function, and prevent complications. So some examples of that would be splints and braces. You've probably seen this in the clinical setting. We're also going to talk about some adaptive devices. Adaptive devices, which you can find on page 449, and I will also link a video in D2L of some different adaptive devices and how they work. But this is an example that helps them to hold the spoon so they're able to feed themselves. There's lots of examples. Like I said, watch that video when you get a chance. Here's a positioning device. It's called a foot board. This helps to prevent foot drop. So if you just lay in the bed and your toes tend to relax down in a pointing position, well, if you don't ever have them pushed up, when you get to a place of wanting to stand up and they're in a permanently pointing position, it would be very difficult to walk at that point. This other picture describes a bed cradle. And the purpose of this is to keep the linen off the feet to help prevent breakdowns in the skin or decubitus ulcers. This is a picture of a heel protector. Heel protectors are what we're trying to do when we put the pillows under the heels. We're floating the heels. The heel protectors help to keep decubitus ulcers or bed sores from forming. A trochanter roll. You can use a towel, a bath blanket, or they have special ones that you can also use. Where you see the dotted line is what is underneath the body. And so the purpose is this keeps the hips from externally rotating. So if you lie there and your hips externally rotate, then the outside of the knee, the bony part, or the outside of the ankle is going to be more prone to having a bed sore. So this trochanter roll certainly can help with that. Here's just another picture showing trochanter rolls and kind of what the purpose of that is. The next picture we're going to discuss is the hip abduction wedge, and this can help with keeping the body in alignment, keeping the legs from crossing, especially if they've had hip replacement surgery. That is something that you don't want the legs to cross because it can pop that joint out of place. Here's some hand devices that keep the fingers separated, keep contractures in the hands from forming. Or if you don't have those fancy devices, then you can use a rolled up washcloth as a hand roll. Bowel and bladder training is also another very important aspect of rehabilitation because we want them to be independent at home. Make sure you look back through your range of motion exercises. You want to put the joint through its full range of motion. The purpose is to decrease or prevent contractures, to improve circulation, improve strength. You can find more information about this in your book on pages 450 through 456. Make sure you know these different abbreviations. There's active range of motion, AROM, that's done by the resident alone, or there's active assisted range of motion, AAROM, and that's done by the resident with help, or passive range of motion, which is PROM, and that's done without any help from the resident. That's what we practiced in lab. You also will need to know the following body movements, which are all the different abduction, adduction, flexion, extension, etc. There is a matching component on your quiz, so it's going to be related to these things. Make sure you know them and you can match them up appropriately. Guidelines for range of motion exercises. Make sure that you don't push past the point of resistance. You're maintaining privacy. You start at the top and work your way down. We don't do exercises for the head or neck. We want to follow their care plan. Always support the joint above or support the limb above and below the joint that's being exercised. If they're complaining of pain or you meet resistance, go ahead and stop and make sure you report it. Keep that body in good alignment, and remember to exercise both sides of the body. Range of motion is a great opportunity for communication. Can see if they can follow directions. It's great to get their bodies moving. Also to be assessing the skin. So take good advantage of opportunities.